So, good afternoon, Excellency, Honorable Speaker, distinguished guests, ladies and gentlemen. Warmly welcome to our 10th panel discuss of AVI-SDG Dialogue. My name is Kim Liang, a junior researcher of the Center for Sustainable Development Study of Asian Vision Institute. And this is my great pleasure to be a moderator for today's program. And our webinar today has brought the 10 topics of our webinar series on social protection and sustainable development on the floor discussion. So we would like to acknowledge on what are the progress and the challenge in achieving the social protection and the sustainable development of the SDG 1.3, and what are the key interventions being implemented to support social protection amid the COVID-19 pandemics. What are the short-term intervention and long-term strategy for supporting social protection for the post-COVID recovery? Excellency, honorable guests, ladies and gentlemen. In this meantime, we are honored to have our permanent leader who and the researcher in our diverse development field who will deliver their valuable comment in our program today. And before starting our program, please allow me to introduce our honorable speaker who are waiting on the screen to share their presentation and comment. First, please allow me to introduce His Excellency Heng Supanarat, the Deputy Director General of and the spokesman of the National Social Security Fund. He graduated a master's degree in Finance and Public Administration at the National University of Management of the Kingdom of Cambodia. He is skillful at negotiating, facilitating, and coordinating with all parties and experience in social protection, particularly social security scheme. As the NSF spokesman and the senior leader, he is extremely active with the national and international stakeholder in discussion, input collection, and comment in to promote the implementation of the social security scheme in Cambodia toward the universal coverage. And the second, please allow me to give a warmly welcome to our honorable speaker, Dr. Shamir Khatiwada, Associate Sector Specialist of Southeast Asia Department of ADB. Dr. Shamir is our economics who lead preparation and implementation of the ADB loan and technical assistance projects in the area of education, skill development, social protection, and jobs. Prior to joining ADB operation in Southeast Asia, he was with the macroeconomics division of the research department at ADB. And his research interest is spread across the areas such as the impacts of technology on the employment, innovation, and the structural transportation, industrial policy, enterprise dynamics, and impacts of the COVID-19 pandemics on the labor market. Before joining ADB in 2017, he spent close to 10 years at the International Labour Organization. As a Nepalese national, he holds a PhD in economics from the Graduate Institute of International and Development Study in Geneva, and he has a master's degree in public policy from Harvard University. And third, please give a warmly welcome to our honorable speaker, Mr. Jiayu Go, a program manager of social protection in International Labour Organization. Mr. Go is a program manager of social protection with International Labor Organization in Cambodia. He is the ILO focal point for social protection in Cambodia and serves as a technical advisor to the government, institution, and the social partners such as employer group and the trade union. His work focused on the development of the social protection system by increasing capacity within the national institution through better adaptation of technology, expanding coverage, and improving benefit through enhanced cooperation framework and implementation, and improving the accountability through the M&E policy and strategy review. He is a pragmatic advocate of the right-based approach to the development and passionate about the pro-poor economic growth and addressing systematic inequality. Prior to his current role, he spent 7 years as a consultant specializing in data analysis and digital transportation for the MNC, SME, and the government institution in the Southeast Asia. He holds a master's degree in public policy from the Maastricht Graduate School of the Government and the United Nations University Maastricht Economic and the Social Research Institute on the Innovation of Technology. Excellency, Honorable Speaker, distinguished guests, ladies and gentlemen. Follow our agenda today. We will be started our captivating program with the first agenda on the role of ILO for the social protection and sustainable development, progress, talent, and recommendation, which will be conveyed to speak by Mr. Jie Yuko. And the second on the role of ADB for the social protection and sustainable development, progress, challenge, and recommendation. And the speech will be delivered by Dr. Shamir, right? The third is on the government policy and the intervention for the social development and sustainable social protection and sustainable development, and the speech will be delivered by His Excellency Heng Suphanadit. And for the last of our agenda, we will open the floor for this joint discussion, and then we will have a group photo section at the end of our program. So, Excellency, honorable guests, ladies and gentlemen, if you wish to have any question during the presentation periods, please drop the question in the Zoom chat box or our Facebook Live. So without further ado, I would like to invite our honorable speaker from ILO, Mr. Jie Yuko, to deliver his speech. Mr. Please, the floor is yours.
Hi, very good afternoon to all the distinguished panelists and to all who are attending this both on Zoom, on Facebook live stream, or wherever you are. Very good afternoon, good morning, depending on where you are in the time of the day. I just want to check that that everybody could see the screen that I've shared, and if you are not able to do so, perhaps please let the moderators know so that they will be able to we'll be able to do some adjustments to go. So I have a very short presentation. It's a very short presentation. It's about 10 slides plus that really touches very broadly about social protection and sustainable development, focusing very much on Cambodia. So As you can see, social protection is a major part of the SDGs. The work that we do here from the ILO on social protection covers largely in terms of 4 of these SDG goals. The first one being the 1.3, which is to implement nationally appropriate social protection systems and measures for all, including flaws, and by 2030, achieve substantial coverage of the poor and vulnerable. It also links with SDG 2.2, where by 2030, we hope to end all forms of malnutrition, including achieving by 2025 the internationally agreed targets on stunting and wasting in children under 5 years of age, and addressing the nutrition needs of adolescents, girls, pregnant and lactating women, and older persons. Social protection also involves is also involved with links with the SDG 3.8, which looks at achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now, to achieve an effective and social protection system, there was also a need to ensure that the institutions that are supporting social protection schemes and activities are effective, accountable, and transparent. And hence, this is a direct link to SDG 16.6 on the development of effective, accountable, and transparent institutions here in Cambodia. So what does social protection looks like in Cambodia here in 2022? So this is a image that looks into how social protection looks like across the 7 different areas of the life cycle where we look where social protection could plays a role. So as you can see, since the launch of the National Social Protection Policy Framework here in Cambodia in 2017, there actually has been significant expansion in the scope of social protection schemes in place within a relatively short time frame, 4 years since the NSPPF was approved. Various new schemes have been introduced, existing one has been expanded, and others are planned for imminently planned to be included, such as the pension scheme, perhaps in the future, the unemployment scheme, and as a family package to bring in all the social assistance program together with components such as the elderly cash transfer scheme. So the COVID-19 has also posed a challenge for the system development, but it has also resulted into the expanded scope of the system in relation to the shock response and the emergency response of nature of the social protection system. So however, when we look in terms of coverage, despite the whole growing scope of social protection and the introduction of new schemes, the coverage of social protection is still very limited here in Cambodia. Overall, no risk is more than 40%, no more than 40% of the covered population is covered by a single risk, if you can, at risk area. In fact, for certain schemes like OH, certain risks like OH, disability, work injury, you still see a large proportion, and I mean more than 80% of the population, they are left uncovered. Even with the extent of the COVID-19 social protection response, which includes the very impressive COVID-19 cash transfer program, the total that cash transfer program only covered at least 20% of the total population, which this implies that given any kind of social assistance or social security program, at any point of time, only 20 to 30% of the people in Cambodia receive some form of support at a given time. We can also see that social protection expenditure in Cambodia remains relatively low compared to other countries in the Asia-Pacific region. Cambodia spends about 2.3% of the GDP in total, and this figure is roughly equally divided between healthcare and other social protection expenditure. This total constitutes the 5th lowest level of expenditure in the region, only trailed by Bangladesh, Laos, Myanmar, Pakistan. Comparatively, middle-income countries such as China or Vietnam spends between 10.1% to 7%, which is significantly more than the 2.3% that Cambodia spends. We can also see on the chart on the right that in this 2.3%, the COVID-19 social protection response entails almost the same size as the regular social protection expenditure on a yearly basis. So this is a diagrammatic explanation of how does social protection look like here in Cambodia. While we have on the left, we have the poor, the near poor, who are in parts covered by the social assistance program. And then where we have on the right, we have the formal sector, which is covered much by NSSF, Social Security, the civil service pension. Some of them are covered by private social security, private social security, private insurance schemes. And then we have the health equity fund that covers parts of the informal worker. We also see that there is actually a sizable missing middle population, which is at least 65% of the population that are not covered by any form of social protection. Vis-a-vis what a social protection in a more mature social protection system might look like, this is also a diagrammatic view of how it may look like. We see that most mature social protection systems, they would have some form of a universal social protection floor that is funded both by government-funded social assistance program and maybe contributory social security program that guarantees a minimum level of social protection for all population within the country. And there may be a different tiered level of social security contributory based benefits that is based on the contribution level of the population and giving higher level of protection for these group of people who contributes into the social security system. So the question that most of the policymakers, ILO, and development partners here in Cambodia is always asked, where do we want to go? This is where Cambodia is in 2022. How does it want to go? Where does it want to go? And how do they get there? And what can be done? So to do this, we kind of look a little bit deeper into this missing middle population. That is at least 65% of the population. And we wanted to know who are the missing middle. So the question of who are the missing middle, I've put out 6 photos here that kind of exemplifies the type of people or the type of population groups that constitutes the missing middle. On the first, you see it's the tuk-tuk drivers. These are considerate about large part of the informal economy, informal workers. The tuk-tuk drivers do not have an employer. They, at the moment, are unable to contribute into the social security system. They do not have an employer to register themselves. They are often not registered, and they work within the informal sector of driving. So this is a group of workers that are in the missing middle. In the middle, you see a lot of street sellers, family-run business, small sellers, businesses, small micro enterprises. They are providing daily services and daily necessities to the people. These are also people who often, because of their working relationship, they are not registered. They are mostly self-employed, and they do not, at the moment, contribute to any of the social security scheme. Neither are they, because they have the means to live, neither do they qualify for the ID poor targeted or poor targeted social assistance schemes. So these are a large group of workers who actually do not enjoy any social protection benefits by basis of them not having an employer and not being poor enough to qualify for social assistance scheme. There, on the right is a typical picture of a beer garden and workers. And these are actually big groups of workers who may be working in informal enterprises. There are a large number of enterprises here in Cambodia who are not registered, not registered as economic unit within the various ministries. So by default, the workers who are working in these informal enterprises are also informal and hence do not receive any social protection benefits. During the COVID-19 crisis, we can see that there are many of these such enterprises, especially in the tourism sector, where they are unable to enjoy the benefits of the wage subsidy that the government of Cambodia have introduced because these workers and these enterprises are not registered. The fourth picture is a picture of some of these workers. They are working in hotels, resorts, and these hotels and resorts are largely formal enterprises. However, within a lot of the formal enterprises, there are also workers who are informal and who are informal. They are either working on a contractual part-time arrangements. They may have a contract, but they are not registered with the National Social Security Fund, and hence do not contribute to any of the social security schemes, and hence do not qualify for the social protection. So this is also another group of workers which will need to be brought into the social protection system if we are to address the issue of the missing middle. And here in the center, we also have elderly people. There are also many elderly people in the rural areas of Cambodia who have worked and supported and contributed to the Cambodian economy for the last 10, 20, 30 years of their life. And they have lived largely on subsistence and provided and contributed in their own ways. However, as they are not registered, similarly, they do not qualify for any of the social protection benefits. And the last picture here, it's often forgotten about when we think about the missing middle. These are the people who are students and the young people who are still going to school. They have not started work, but for many of them, if they come from relatively, I would say, middle-income families or families who are not poor, they don't receive any protection. They don't receive any protection from the current social protection system. I'll go in and quickly just look a little bit more into this labor force. This is from the labor force survey that was done in 2019. And we see that in terms of the total working population, there is about 11.5 million here in Cambodia. And the economic active is about close to 8 million, 7.98 million people. The unemployment rate is low in Cambodia, and this is typical. But when we look into how informality looks like in Cambodia, we notice that there is Cambodia enterprises and labor force is highly informal. 75.5% of all enterprises are informal, and 69.4%, this is not just an urban or rural issue, because 69% or close to 70% of the urban enterprises are also informal. In terms of employment, 87.5% of all employment are informal, which, as you can see within the urban, it's 85%. So it's clear that informality is persistent in both urban and rural area, and that informality has little gender effects, with actually slightly more female informal employment, and that's largely because the manufacturing sector, which disproportionately employs more female than male, is largely more organized and formal, and most of the workers who are in the manufacturing sector, the government manufacturing sector, are registered with the Social Security scheme, with NSSF, and they are enjoying the social protection. So I also wanted to share this particular curve, which is actually the predicted per capita consumption based on the CSES and the ID Poor survey that was done during last year's 2021 COVID-19 lockdown cash transfer assessment. You can see that in terms of the average per capita consumption in Cambodia, for people within the bottom decile 1 through to the number 7th or 8th decile, there is actually very, very little differences between their average per capita consumption. This spike is the old spike you see in consumption comes in at the 9th and the 10th decile, where it's different. So this, I think, is a very important point to note, because what we can see is that here in Cambodia, the economy has not progressed to the point where you see a sizable middle class. You have not seen, at least through this consumption curve, you have not seen a huge middle class being formed. And you could arguably say that people who are in the bottom 20% and people who are in the middle are very similar. As you can see, their consumption per capita is about 12,000 at the bottom at decile 1, and the fifth decile is only about 20,000, which is just 8,000 real more. That's about $2. So broadly, what can be done to address and to improve social protection coverage here in Cambodia? We put it, I mean, there's this, we can go into much more details, but I'll put it broadly into 6 areas. First is to expand the coverage and adequacy by pursuing a dual but complementary approach to closing coverage gaps that combine both social assistance and social security tiers. The second is to efforts to extend coverage should form part of the national strategy for formalization of the labor market. The third would be to progressively increase the level of social protection expenditure, recognizing it as a precursor to the system effectiveness. Fourth would be to adjust or establish governance arrangement to support this process at both the policy and the operational level. Fifth is to strengthen linkages between the social protection sector and other areas of public policy like education, housing, labor. Last but not least is to look into investing into digital integration of social protection, which can include, for example, a single beneficiary registry, social registry, and linkages with other data sources for routine and short responsive social protection. So I'll end my presentation here very quickly, with a quote that a journey of 1,000 miles begins with a single step. And I think here in Cambodia, this first few steps have already been taken. And hopefully in the 5 and 10 years time to come, there is much better, we will see a much improvement and progress within the social protection here in Cambodia. Thank you.
Thank you so much, Mr. Finn, for your nice presentation. And for the next, I would like to invite our honorable speaker from Asian Development Bank, Dr. Shemer, to convey his remark. Please, Doctor, the floor is yours.
Thank you so much. Thank you for having me. It's great to follow Finn's presentation. The what could be done, next steps. I think we have something to contribute in those aspects. I'm going to try to share my screen, and hopefully you can see the presentation shortly. Please let me know you can see the presentation okay, and then I can begin. Can you see it? You can give me a thumbs up. Great. So what I will do today is basically, I'm on the second slide. I hope you can see the second slide, the outline. So what I'll do is quickly talk about the economic and labor market context in Cambodia, and Finn also touched upon this already. So I'll try to keep it short. On the social protection key issues, again, this builds on the presentation from the ILO. And then I'll get into ADB's projects in social protection and what we are planning in Cambodia in the next few years. We have a project in preparation for 2023 approval for next year. And we have a TA on digital social protection as well that's ongoing in Cambodia. Take TA meaning technical assistance, grant support to Cambodia. So this, is going to sound very familiar to most of us, I hope. The economic and labor market context, if you just start with poverty first, before COVID-19, high economic growth over the past 20 years led to a significant reduction in poverty from 60% in 2000 to 12.9% in 2018. In 2019, 2020, 17.8% of the population below the national poverty line. So Cambodia had made a tremendous progress in the first 2 decades leading up to the COVID-19 pandemic. When you look at the working poor, these are estimates also from the ILO. In 2019, 8.3% of workers were extremely poor, while 28.6% were moderately poor. Again, this is a progress from the past decades. But after COVID-19, of course, things might have changed, and we are still looking at the data, and some of the new findings that ILO has been collecting is also very helpful in that regard. First is economy is estimated to have contracted by about 3.1% in 2020. It grew by 2.2%, so it did bounce back, but not as strong as in the past. And the projection for this year is about 4.5%. The high frequency surveys revealed that household incomes fell by almost 30 to 60% in 2020. And about 19% of all households received some kind of government cash transfer as part of the COVID-19 response, which has been tremendous when we look at the numbers. But the reality is that estimates show that about 130 to 205,000 additional workers fell into extreme poverty in 2020. This is based on the ILO's working poverty database.
Sorry, Dr. Sumner, I just interrupt you. I think the slides, we are not seeing your slides in the slide mode. We're seeing the slides in the PowerPoint, and it's not moving. So we're still looking at your first screen. Oh
no, okay. In that case, I'm gonna actually go back to I don't know why it's like that.
Okay, this is good. I think we saw the. I think if you could
let me just actually make this a bit bigger.
I think this is fine. This is good. We're looking at the this is good.
Okay, let me just make it a bit bigger so that you can actually see it. My apologies. I don't know why that keeps happening. All right. It's okay now, right, Finn? It's okay?
Yep, it's good. I think it's in the correct slide, and I think if you move it, we'll be able to see it. Thank you.
Okay. I'm not going on slideshow mode just to avoid again the slide's not moving. Unemployment rate was low in 2019, 0.7%, but the unemployment rate is usually not a great indicator of the labor market in a place like Cambodia because of the informal sector. We, as Finn pointed out, also that there's a large informal sector in Cambodia, and this, might have the size of the informal sector might have actually increased during the pandemic. When we look at the coverage of social protection, again, 6.2% of population covered by at least one social protection benefit, and only about 27 to 31% affiliated with social health protection. So that includes the health protection as well. After COVID-19, because of job losses, again, there's a lot more people that needed social protection support. And here, ADB has been heavily involved as well in working closely with the government, especially with Ministry of Finance. What I'm going to do is I'll go to the next slide, sort of give an overview of social protection in Cambodia. The National Social Protection Strategy from 2011 provided a strong foundation for social protection in Cambodia, establishing numerous schemes under the three main pillars. First, social assistance, social insurance, and labor market programs. The Health Equity Fund, as Finn also mentioned, in the middle you saw the HE. In Cambodia, it's Cambodia's largest social protection program in terms of coverage, offering free health services to at least 2 million poor Cambodians. ID Poor, as you know, serves as the country's primary socioeconomic registry of poor and vulnerable households, and it's also the basis for targeting assistance. COVID-19 brought social protection to the forefront of the government's response efforts. By December 2020, planned SP spending after the COVID-19 response increased by about 1.3 billion, which included 306 million for a relief cash transfer program. ADB's response during this time was about, I think the loan to Ministry of Finance was about 250 million. This was in 2020. As of October 2021, 678,000 households identified through ID Poor had received a cash transfer from the government. The average transfer size was about $45 per month. Additionally, the government provided a one-off cash transfer to non-ID poor households that were affected by COVID-19. And as of August 2021, 121,000, about a little over 121,000 households had received this support. Some of the key issues on social protection, you know this already, so I'm just going to go over this briefly. The first one is under coverage of social protection programs, right? And as Finn also mentioned, that there is a large missing middle. And again, we need to not only sort of increase the coverage, but also the adequacy of benefits as well. And that's the second bullet point there, the inadequate benefit levels. That's also another issue with social protection schemes in Cambodia. The third point there is on labor market volatility and high informality leaves informal and migrant workers particularly vulnerable. This is an area we also need to work on. According to the UNDP's Accelerator Lab, 9 out of 10 informal workers had not received any form of social protection support since COVID-19. Geographic and administrative fragmentation of social protection programs. And again, this is not an issue just for Cambodia, it's also an issue for other countries in Southeast Asia as well. But it's worth mentioning that this is one of the challenges that the country faces. And the last one is on limited integration of national social protection with human capital development and ID system. Again, so one of the things that ADB has been trying to do is sort of think of social protection as part of a broad umbrella of human capital development. And we've been doing this in other countries like in Indonesia and Philippines as well, where social protection is one of the areas where we work under the umbrella of human capital development. Examples of ADB's social protection experience in Asia and the Pacific. Just the two I wanted to highlight is the Philippines and Indonesia. In the Philippines, we have been providing support to the government to their Pantawid program, which is a massive cash transfer program, conditional cash transfer program in the Philippines. We've been involved in different aspects of this, improving targeting, that's one, which includes the health and education conditions as part of the CCTs. And we also have been involved in innovations in IT systems, digital payment systems of the Pantawid program in the Philippines. And again, the graduation approach as well to poverty reduction, that's an important aspect of our work. And an upgrading capacity of social workers who are actually on the front line implementing some of these programs, because that's something that's very important, and ADB has been heavily involved in that aspect as well in the Philippines. In Indonesia, again, we have been involved in several different areas of social protection, and we've been developing a program that improves the delivery and implementation of a food assistance program called Sembako. So we've been involved in that program as well. And PKH, we've been involved in PKH, which is a food family hope program, which is a food, it's a social assistance scheme. Again, one of the big programs, social protection programs in Indonesia. And there we have been working closely with the Ministry of Social Affairs, MOSA, to improve capacity and also the IT systems as well in the delivery of social protection. The last row I've highlighted there, the region-wide COVID-19 response. This was our CARES program of ADB. In response to the COVID-19 pandemic, the ADB announced a 20 billion package to support member countries to mitigate the economic and health impacts of COVID-19, including social protection support. In case of Cambodia, as I mentioned earlier, it was about 250 million was lent to Ministry of Finance. It was in 2020. I want to spend a bit of time on this slide. This is our tentative social protection project that we have been developing. The main government agency we've been working with is the National Social Protection Council, NSPC, and also we're working with MOSAVI and also MOSVI and also Ministry of Planning as well and Ministry of Finance. Those are the four government agencies we've been working with in developing this project. The indicative financing at this stage is about 80 million. What we plan to do, the second row there that you see, the three areas where we want to focus on. The first is social workers' knowledge and capacity to implement social protection programs improved. So this focuses on the implementation and the delivery of social protection programs. Social protection delivery systems strengthened. This has a strong IT component to the number 2, the Roman numeral 2. And lastly, institutional capacity to coordinate and integrate social protection programs and implement sustainable financing options for social protection enhanced. And this is an ongoing area that we are working also closely with the government. In terms of the knowledge that I have, their impact, of course, I think this is self-evident, but in terms of the knowledge, we're also bringing in some TA support to help us prepare the project. And in terms of innovation, we are leveraging some of our experience from other countries in developing Asia, particularly in terms of digital systems, improving the delivery of social protection programs by enhancing digitization of many aspects of social protection delivery. And we have valuable lessons from other countries, and we will be leveraging that in Cambodia as well as we develop this project. And I'm happy to provide you more details about this project. It's still under preparation. The plan is to get it approved in 2023, 2023 next year. Lastly, I wanted to talk about this grant support that we have ongoing with the National Social Protection Council, the TA support, which is aimed at improving efficiency, effectiveness, and accountability in delivery of selected public and social services. It's about 2 million. It's funded by JFPR, and it has two main objectives. The first one is an integrated digital platform for social protection programs developed and implemented, and the capacity of stakeholder agencies enhanced. And the second is a feasibility study on a scalable subnational e-government model conducted and capacity of the target subnational administrations enhanced. And so if you wonder what has been achieved so far, the two I put in there on the slide, the first one is completed the analysis of existing social protection systems. And second is completed technical design of integrated social protection registry and integrated IT platform for SP services. Those two things have been done. What's next is that as part of the grant support, we'll be developing the integrated social protection registry and the IT platform with National ID, CAMDX, ID Poor, etc. Within 5 months from now, so meaning by basically before the end of this year. Carry out pilot project deploying the integrated SP registry and integrated IT platform in 2 target districts, covering about 10,000 people. Again, this is also aimed to be launched by this year. It might be extended to 2023 as well. And we'll do a survey before and after the pilot project as well. So that really sums up my presentation. I don't want to go over the annex slides, but I'm happy to share the slides with you. In general, I think what I want to leave by saying is that, and I look forward to hearing the thoughts of His Excellency as well, who's going to come after. But in general, what we have done is that basically what Finn presented from the ILO is that we looked at what are the challenges in social protection space in Cambodia and tried to design this new project that we are currently preparing in close consultation with the government, and also leveraging on the TA support, this particular TA on digital social protection as well. So I welcome your feedback and comments, because we are still designing the project. We have a good way to go before this is implemented. So I look forward to hearing from you and your thoughts. Thank you. Over to you.
Thank you so much, Doctor, for your insightful presentation. And next, please allow me to turn the floor to our honorable speaker from National Social Security Fund, His Excellency Heng Sophanarat, to deliver his remark. His Excellency, please, the floor is yours.
Yeah, thank you, Ms. Tang Kim Leng, and a very good afternoon, distinguished ladies and gentlemen. Allow me to introduce myself again. And my name is Heng Sophanarat. I'm Deputy General Director and spokesman of the National Social Security Fund, and also responsible for Social Security Policy Department and Customer Service and Public Relations Department. And here's my content today. There are 3 content, such as first, social security, social protection in Cambodia. Secondly, implementation of social security scheme in response to sustainable development goal 1.3. And third is intervention during the COVID-19 pandemic and long-term strategy to support social protection for the post-COVID-19 recovery. Firstly, I'm talking about the social protection in Cambodia. Yeah, as you know that the national social protection in Cambodia, based on the national social protection policy framework, we provide two parts. One is social security, and secondly, social assistance. Social security, we have 4 schemes. One is pension scheme, healthcare scheme, occupational risk scheme that we call work injury insurance, and the last one is unemployment scheme. Regarding to social assistance, also have 4 schemes such as emergency response, human capacity development, vocational training, welfare, and vulnerable peoples. Secondly, I'm talking about the implementation of social security scheme and respond to sustainable development goals. And first, we're talking about the progress of the social security scheme implementation. According to the implementation of the past 10 years, the royal government observed that the law on social security scheme for persons defined by the provision of the labor law doesn't cover comprehensively, so the royal government established the new law on social security scheme in 2019 in order to provision of the labor law, to make the consistency between public and private sector. And the old law cover the insured person as follow: all workers defined by the provision of the labor law, state worker, public worker, and every personnel who are not government by the common state of civil servant or by diplomatic status, as well as officials who are temporarily appointed in the public service, trainer, person who is attending for rehabilitation center, and represented shall be regarding as worker. Person work in the self-employed profession, seasonal or occasional workers. And the new law, our new law that have been adopted in 2019, we have a person under, we cover the person under the public sector, that we have official in the civil servant service, official of legislative group, official of justical instrument, national policy officer, person officer, a prison officer, officer of the National Election Committee, official of the National Audit Authority, former civil servant service and veteran, and contract official recognized by the Ministry of Civil Service. And another one is a person defined by the provision of the labor law, including personnel serving and the air or maritime transportation, as well as domestic worker. And lastly is self-employees. Secondly, we're talking about what is NSSF. Yes, I know that everyone understood clearly that NSS, what is NSSF. As you know that NSS is a public entity under the technically third of the Ministry of Labor and Vocational Training, and the financial third of the Ministry of Economic and Finance. NSS is led by the governing body with tripartite composition, representative of the royal government, representative of the employers, and representative of the workers. Thirdly, we're talking about the law on Social Security scheme cover is insured person. According to the Article 3 of the new law on Social Security scheme adopted on 2nd November 2019, the person under the public sector are as follow: official in the civil servant serving the ministry, institution, and unit at the national and sub-national level that are defined by the provision of the labor law on the common status of civil servant of the Kingdom of Cambodia. Secondly, official defined by the law on the status of official of the legislative group with the exception of the person scheme. Thirdly, official serving at the justical institution. Fourth, national policy officer and prison officer receiving only the medical care benefit of healthcare scheme. Fourth, official serving at the National Electric Committee. Fifth, official serving at the National Audit Authority. Six, officers serving at the civil servant and veteran. Seven, contract officers serving at the ministry, institution, and unit at the national and sub-national level recognized by Ministry of Civil Servant Service. And lastly, person in other public sector regulated by the subdegree. First, we're talking about the current implementation of Social Security scheme. Currently, we have implemented two schemes already. One is a Social Security scheme on occupational risk that we have launched in 2008. And secondly, Social Security scheme on healthcare scheme that we just launched in 2016. And thirdly, Social Security scheme on pension scheme that we have planned launch in this year, 2020-21, but according to our COVID, we have delay. And right now we are waiting the blue one. It means that we waiting the answer from the government that provide NSF to launch a pension scheme. And fourth, implementation of healthcare through health fund system for informal worker and provision of additional allowance for personal worker. Is that our data for that we have implementation of the Social Security scheme on occupational risk. As you know that the Social Security scheme on occupational risk has been launched since 2008 by only cover the private sector, and this graph above show that since 2015 Cambodia has implemented in line with the Sustainable Development Goal Target 1, no poverty. The gradual increase of the NSS member is the positive point of development in social protection and contribution to eradicate poverty in line with SDG. Furthermore, in 2021, the royal government of Cambodia decided to expand the Social Security scheme on occupational risk for public employee, leading to the increase of the NSS member amount to 1.6 million insured person, and ensuring the consistency of the Social Security scheme between public and private sector. And for the public employees during receiving medical care service resulting from the occupational risk at the health facility and nursing home, in line with the prescription of medical doctor or physician organized by NSS, the salary for person concerned shall be still provided. And our benefit, we have a medical care service, we have a daily allowance for temporal disability, and also have a lump sum for permanent disability less than 20%, person for permanent disability from 20% up. We have rehabilitation and also funeral grant and survivor pension benefit. And this point also data from healthcare scheme. And social security scheme on healthcare has been launched in 2016 by only cover the private sector. The graph above show that since 2016, Cambodia has implemented in line with the Sustainable Development Goal, Target 1. No poverty also is a new scheme, has been launched later than occupational disease for each year. Based on experience of NSSF have trust the real government on NSSF. Social security scheme on healthcare for public employee, former civil servant, and veteran has been launched in 2018. This graph also shows that access to healthcare scheme increased over 1.4 million members in 2018 and continually increased over 1.8 million members by Q1 of 2020-22. And the result highlights the positive point of development in social protection and contribution to eradicate poverty in line with SDG, as well as the contingency of the social security scheme between public and private sector. And here is a healthcare benefit. Here we also have 4 benefit for healthcare scheme. We also have a medical care service, daily allowance for a qualified period of medical care, maternity allowance, and funeral grant. And thirdly, about the implementation of social security scheme on pension scheme. As you know that I have mentioned before that this pension scheme we have ready for sub-degree legislation, and we are waiting the blue one from Ministry of Economic and Finance that this ministry decided NSF have launched pension scheme. Before that we have it means that we have planned to launch in 2019, but according to COVID-19 we also delay and until now. So we hope so that this year we can launch this pension scheme at the mid of this year. Fourthly, implementation of social security scheme on pension. We also have the draft of benefit. It means that pension benefit, we have 4 benefits, such as old age pension, invalidity pension, survivor pension, and also funeral grant. And this slide also mentioned about the implementation of healthcare through health equity fund system for informal worker and additional allowance for person worker. Interministry, we have also interministry Pakas 404 on implementation of healthcare through health fund system for informal worker and additional allowance for postal worker was implemented in January 2018. And currently we have a member register around 941 enterprise within 91,000 worker. Among that, we have 20,000 worker are female, including member of commune council, chief of village, deputy chief of village, and assistant of chief village, amount to 50,000 member, and sport player amount to 1,000. Cyclo driver, motor tuk-tuk driver amount 17,000, and the rest is domestic worker around 20,000. And another one, NSS also provide additional allowance for the royal government to female around 292,000 postnatal worker, and within the 294,000 baby in February 2022. Yeah, including we also divide that we have informal sector around 868 personal worker, and formal sector around 291,000 personal worker. Regarding to our implementation, we also have some challenge. The National Social Security Fund, we have some challenge, such as Social Security scheme is the new scheme that there was no any personnel. And secondly, lack of resource. It means that official contract staff, transportation. And thirdly, lack of technology, hardware, software, computer benefit calculated by hand, etc. And fourth, owner of enterprise establishment did not have a collaboration. And fifth, worker did not have additional national ID card, and they also borrow the national ID card from other person. Lastly, we also have problem of someone contract health facility service provision. In response to the COVID-19 pandemic, the royal government have support the social protection by issuing the measures through Ministry of Labor and Vocational Training. One is worker receive $70 a month, including garment sector, provide $40 by the royal government and $30 from the employer. Secondly, tourist sector, we provide $40 from the government and additional allowance from the employer based on their responsibility. And secondly, workers who are suspend their work, their employment contract still receive healthcare benefit, although any establishment, enterprise in garment, footwear, travel good, beach, and tourist sector suffering from this pandemic request for suspending the contribution payment. Third, informal worker who register with NSS still receive healthcare and additional allowance from the royal government when deliver a baby. Fourth, implementation of social security scheme on pension is still delayed based on the actual social economic situation. NSS has complied with the duty in accordance with the law on social security scheme and social protection, and was authorized by the royal government. Moreover, in response to COVID pandemic, NSS has implemented the intervention and plan as follows. For any enterprise establishment in garment, footwear, travel good, beach and tourist sector impact by pandemic, request for suspend the contribution payment, and still provide healthcare benefit. Launching social security scheme on pension. Launching mandatory healthcare scheme through the pilot spin project for the target group, such as tuk-tuk driver that we cover, or that we collaborate with the IDEA Association, and domestic worker with the AWD Association, and launching this pilot project based on the actual social economic situation after COVID-19. And lastly, expand social security scheme on healthcare to the family of the NSS member. Yes, that is my slides. Thank you.
Thank you so much, His Excellency, for your insightful presentation. Excellency, distinguished guests, ladies and gentlemen, we have been enjoying listening to our very insightful comment from our honorable speaker. So our program now approaching to open the floor for discussion. By the way, as Dr. Shemir have an urgent task, he may leave first. Thank you so much, Doctor, for joining us today.
Thank you.
You can leave first, sir. So, however, as we have time limit, I would like to random select some question for our speaker. So the first question I would like to refer to Mr. Finn. Hello, Mr. Finn.
Yes, hi.
As shown, the cover rate of the social protection in Cambodia is quite limited. Does ILO work with the NSSF or any other organization to improve the social protection in Cambodia?
Thank you. I think this is a good question. Yes, of course, the ILO is working with the National Social Security Fund, and also with other stakeholders such as the National Social Protection Council, the General Secretary on the National Social Protection Council, and also with MOSAV, Ministry of Social Affairs, Veteran and Youth, in order to extend social protection coverage. This is not just done with ILO. I think this is a work that is being engaged in partnership with other UN agencies like the UNDP, like UNICEF, who the ILO work and cooperates with, to ensure that we are able to deliver an integrated and a more comprehensive approach to extend and improve the social protection system. So an example of such activities would be a joint project between ILO and UNICEF. It's not called Advancing Social Protection in Cambodia, that is supported and funded by the European Union in Cambodia. So this project is over a 3 or 4 year period of time, which looks into supporting the extension of social protection, both through from a policy perspective to ensure that more people could be put into the scheme, could join the scheme, but also in terms of supporting the institutions like NSSF and the GS and MOSAV, GS NSPC and MOSAV, to be able to implement this new these new schemes and to support and to provide the level of transparency and accountability as required for the social protection system. So these are a big broad base of work, and I think Dr. Samir was also sharing, I think the integration with some of the work that ADB is doing on digital is also a part of the work that the ILO is also working on. But I think I will, if there is a question on this, I will let, maybe we could have the question sent to him and then we can follow up from there.
Thank you so much, Mr. Finn. The next, I would like to refer the question to His Excellency. As some people have complained about the unfairness of treatment at the hospital or the complicated process to use the NSSF card at the hospital, have the NSSF worked on the hospital to improve this service?
Yeah, thank you. That is a good question. But I think that is the old complaint that I got from other insured person or other representative of the worker. Yeah, before that we have a lot of complaint because we just launching the scheme, and another one it related to the knowledge of the worker. They don't know the flow of the flow that access the healthcare service. When they go to the hospital, the hospital, they think that their NSS card is VIP card. They need to provide this card to doctor, and doctor need to treat them quickly. So they don't know how to it means that the health facility process. So this problem NSS it means that NSS have a hospital agent that there is a NSS staff to stay at the hospital or river hospital. As I remember, maybe from CPA3 up, we have NSS agent that they need to facilitate them when the insured person come to the hospital. They need to come to the counter and to provide their NSS card to hospital agent, and they need to issue patient form. And they got the patient form, they can go through to check up with the doctor. So until now, we don't have any complaint that that you respond. Thank you.
Thank you so much, His Excellency. The next question. Most likely, we heard a lot about the social protection for the poor and vulnerable in Cambodia. And how about the youth? How the social protection benefit them, or how it looks like? So, any comment from Mr. Finn?
Sorry, could you repeat the question again?
We are mostly like, we heard a lot about the social protection for the poor in Cambodia. How about youth? How social protection benefit them?
I think so how does social protection benefit the youth is a very important question. I mean, Cambodia is a very young population. Most of the we know that Cambodia, the population is young, young, but it will also, in a very short period of time, in the next 40, 50 years, become a very quick aging population, because two things that we see across the world: improved healthcare, so increasing life expectancy, and then decreasing family size. Most families are having less and less children nowadays. So this Cambodia youthful population in 30, 40 years will become an old population. So how does social protection, and why is social protection relevant to the young people? Now, so for most countries around the world with very mature social protection system, social protection is part of the education curriculum. Social protection starts from young. And you can look at the framework of the life cycle, the social protection life cycle. It is a cradle, almost a cradle to grave model, where you start as a very young. When you start as a baby, you receive probably health protection. You probably receive education, free education here in Cambodia, and then as you progress and get older, you accumulate, and you start working. You start accumulating accumulating reserves. You start accumulating, contributing into a social pension scheme, which allows you to have a retirement nest that you can safely retire when you hit the age of 60, 65 with retirement age, and to retire and to enjoy the pension payout. So one of these things we always when we do a bit of the pension modeling is, no, you don't get a pension just because when you hit 65. For many of these people all around the world, they would have spent a good part, 30, 40 years of their active life, working life, contributing into a pension scheme, which would then support them when they retire. So the youth has a very good chance, and here in Cambodia, I think for them, this is a very good chance, because they have a very long runway to build up sufficient savings to contribute sufficient years into a pension scheme, which will allow them at their old age to retire. Of course, Social Security is not just Social Security, and social protection is not just pension. It is also on healthcare. And for young people, there may be instances where you suffer a workplace accident. You could be riding a motorbike and then you get injured, or you could suffer from some diseases. A good friend of mine just caught dengue here in Cambodia. So these are all things that could stop you from working and prevent you from working. And social protection plays an important role, because it will help you to subsidize the healthcare costs that you may incur from catching a non-communicable disease or any kind of illnesses that you may have during the early parts, during your young and youthful age. So I think for the youths, it's very important for you to get to know and get involved in social protection, understand what social protection is, understand how that matters to you, and because you have the opportunity to invest into yourself, to protect yourself, and you have a much longer runway as compared to someone who is my age, who has a much shorter runway to ensure that I could retire comfortably when I hit my retirement age.
Thank you so much. So may I ask the last question to His Excellency? Aside from the role and responsibility of the government and relevant NGO, what are the role of responsibility each citizen of the country on the social security? His Excellency, do you get the question?
Hello, you hear me?
Yes.
Yeah, thank you for the question. I think it is a general question. I think that regarding to the social security in Cambodia, all the citizens we need to participate with the government or other institution that they are responsible for the social security. As you know that from an SSI, we cover with the private sector that have contribution, that has pay contribution. So all the worker and member, they have joined with this scheme. They need to pay the contribution to employer need to pay the contribution to the NSSF. And another side from the MUSWI that cover with the social assistance. I think that all people, they need to register with the with their institution or ministry to get the benefit from MUSWI. And the rest, it means that all the citizens that not cover, the government will cover them step by step. Actually, for the NSS currently cover for the worker, only the worker, but the future they will cover to dependent, and dependent is a citizen, and another one they will cover to health fund or something like that. But I think that the future they will get a universal health coverage for all. But we need to waiting step by step, not quickly. Thank you.
Thank you so much, His Excellency, for your comments. So I would like to thank so much, Excellency, distinguished speaker, for your well-usable comment. As the time limited, I would like to end our discussion here. Before closing our program, may I invite all honorable speakers for a group photo section, please. I will count to 3. 1, 2, 3. Thank you so much, all honorable speakers, for your kind cooperation. Excellency, honorable speaker, distinguished guests, ladies and gentlemen. To end our program, please allow me to express my gratitude to all honorable speakers for spending your valuable time with us today, and for all the audience who are following our program from the start to the end, and wish you all stay safe from COVID-19. Thank you so much. Have a good day.
Thank you.